Overcoming fear and anxiety. Are your fears and anxieties holding you back from achieving your goals and dreams? In this chapter, you will learn how to recognize, understand, and overcome your fears and anxieties so they no longer limit your potential. By discussing the physical and psychological symptoms of fear and anxiety, you can develop strategies to deal with them. You'll also explore techniques for calming yourself when you're anxious, and practicing positive self-talk and self-compassion. This chapter will give you the tools and support you need to improve your relationship with fear and anxiety, and take back control of your life. Take back control of your life. How to overcome fear and anxiety. Understanding fear and anxiety. Fear and anxiety can both be normal reactions to certain situations or tasks. It is a feeling or anxiety about danger or perceived threat. Fear is an emotion that activates the body's fight-or-flight response. This means your heart rate increases, your breathing becomes faster, and you sweat. Anxiety is a natural response to stress, but if left unchecked, it can last longer and become more widespread, even when the source of the fear is gone. Anxious feelings may remain, and anxious thoughts may be difficult to shake. It is important to distinguish between the two, because they each have different causes and effects. Fear is usually a reaction to physical or immediate danger, while anxiety is usually a reaction to perceived or future danger. While fear is a protective response, anxiety can often get in the way. There are many different types of fear and anxiety. Anxiety disorders are typically characterized by excessive worry about various situations, or constant rumination about various areas of life. A phobia can be a fear of a specific object or situation, often due to irrational beliefs. Social anxiety can be an intense fear of interacting with other people, or being judged by others. Common triggers for fear and anxiety include unfamiliar or uncomfortable situations, being in a crowd, or being out in the field. It is important to recognize the physical and mental signs and symptoms of fear and anxiety. Common physical signs include sweating, increased heart rate, increased breathing rate, and tremors. Psychological signs of fear and anxiety include avoidance, obsessive thoughts, and negative self-talk. Anxiety attacks may be characterized by intense and overwhelming feelings of fear or panic. In the next few sections, you will learn some strategies for managing your fears and anxiety. With the right tools and techniques, you can control your emotions and move toward your goals. Understanding the causes of fear and anxiety. Fear and anxiety are a natural part of life. It may be uncomfortable, but it can also help keep us safe and alert us to potential danger. However, if fear and anxiety become excessive, they can interfere with daily life. It is important to understand the causes of fear and anxiety to minimize the negative effects. The causes of fear and anxiety can be divided into three main areas: biological, psychological, and environmental. Biological causes refer to the physical sensations our bodies experience in response to fear or danger. This may include increased heart rate or a rush of adrenaline. These physical responses are regulated by hormones and neurotransmitters, such as cortisol and epinephrine. Psychological causes refer to how we interpret and react to situations. This can include the thoughts we think and the emotions we feel in response to stimuli. Factors such as past experiences and personality can influence how we perceive and react to certain situations. Environmental factors refer to external influences that can affect our levels of fear and anxiety. These may include external stressors such as difficult living situations, noise pollution, or traumatic events. Other environmental influences may include the people around you, the messages you absorb from media or culture, and how you were raised. Genetics also play a role in fear and anxiety. Family history, medical history, and other genetic factors can affect our sensitivity to fear and anxiety. The genetic component of fear and anxiety may manifest itself in an increased risk of developing certain psychological disorders, as well as a tendency to react more intensely to physical or psychological factors. It is important to note that certain lifestyle factors can also increase levels of fear and anxiety. This may include overworking, too much or too little sleep, poor nutrition, and unhealthy coping strategies, such as drinking alcohol or using drugs to cope with stress. By understanding the causes of fear and anxiety, we can take steps to minimize their negative effects. Although fear and anxiety are normal and can be helpful, it is important to recognize that excessive fear and anxiety can be detrimental to our mental health and well-being. By understanding the causes of our fears and anxieties, we can take the necessary steps to reduce their influence and maximize their potential. Identifying and understanding fear and anxiety, being able to recognize the physical and psychological symptoms of fear and anxiety allows you to recognize when they appear and take the necessary steps to manage them. Physical symptoms of fear and anxiety. The physical symptoms associated with fear and anxiety can be uncomfortable and disruptive to your life. Common physical symptoms include sweating, tremors, weakness, difficulty breathing, abdominal pain, palpitations or increased heart rate, dizziness or lightheadedness, and muscle tension or pressure. Psychological symptoms of fear and anxiety. The psychological symptoms of fear and anxiety can be quite debilitating. Common psychological symptoms include avoidance, obsessive thoughts, difficulty concentrating, difficulty making decisions, short-term memory problems, sleep problems, lack of motivation, feeling overwhelmed, and rumination. Signs of an anxiety attack. It's important to recognize the signs of an anxiety attack so you can take the necessary steps to manage your symptoms and prevent the situation from escalating. Common signs of an anxiety attack include shortness of breath, feeling detached from the present moment, extreme panic and fear, fear of dying or losing control, tremors, chest pain, and difficulty speaking. It is important to recognize the physical and psychological symptoms of fear and anxiety so you can manage them and prevent them from getting worse. Some symptoms, such as difficulty breathing or dizziness, are serious and should be taken seriously. If you experience these symptoms, it is important to seek help from a medical professional. It's also important to recognize the signs of anxiety attacks so you can take steps to manage them and help those in need. Strategies to help you overcome fear and anxiety. Fear and anxiety can be overwhelming and debilitating emotions. They can often make you feel like you are out of control and can stop you from realizing your potential. That's why it's important to understand your fears and anxieties and develop strategies to help you manage them better. Relaxation techniques. Relaxation techniques can be very helpful in reducing stress and anxiety levels. Deep breathing, yoga, meditation, and mindfulness can help reduce the physical symptoms of fear and anxiety, such as sweating and increased heart rate, and help you better manage your emotional responses. Cognitive behavioral therapy. This type of therapy aims to help people learn how to regulate and manage their emotions. This will help you identify unhelpful thinking patterns and learn strategies to challenge them, which can help you cope with stress and fear more effectively. Medications. In some cases, medications can be used to reduce fear and anxiety. Anti-anxiety medications, such as benzodiazepines and antidepressants, are often prescribed to help manage symptoms of fear and anxiety. However, it is important to note that to be most effective, medication and other relaxation techniques must be used together. Psychotherapy. If you need help dealing with the underlying effects of your fears and anxiety, it may be helpful to talk to a therapist. Your therapist will work with you to explore the roots of your fears and anxiety and help you learn coping strategies for dealing with difficult emotions. With the right approach and tools, you can manage your fears and anxiety and reduce their impact on your life. Remember that it is a process and it takes time to overcome your fears and anxieties. Be patient with yourself and use the strategies mentioned above to help you cope better. Calming yourself when you're anxious. When you feel overwhelmed by fear or anxiety, here are some techniques to calm and stabilize yourself. These techniques can help you regain control and prevent your fears or anxiety from escalating. Mindfulness activities. Mindfulness activities, such as mindful walking, can be very effective in helping you calm down and ground yourself when you have feelings of fear or anxiety. By focusing on the present moment and observing your surroundings, you can take your focus off of the anxious thoughts or feelings you are experiencing. Mindful walking can also help relieve physical symptoms associated with fear or anxiety. Grounding technology. Grounding techniques involve connecting to the physical sensations in your body rather than your current mental state. This can be done in a variety of ways, including focusing on your breathing, counting and marking each breath, engaging your senses and paying attention to your body. Sensations such as warmth or shaking movement. These techniques can help bring you back to the present moment and reduce discomfort associated with fear or anxiety.